So when a person's told that they have treatment-resistant depression, that's a very hopeless type of diagnosis.
Yeah. In my case, antidepressants didn't work. Actually, it made things worse. I developed new symptoms that I did not have before the medication. They just give you the pill and then you stay there for 10, 20 years and for the rest of your life.
Not everyone is going to respond to B12, but B12 is going to be 100% game-changing for some.
What I envision for the future is to see medications used as an acute form of treatment with the idea that the root causes will be addressed so that those medications can be tapered and discontinued.
Hi, listeners. New Frontiers in Functional Medicine has been going strong since 2015. With almost 200 episodes and over 2 million downloads, my goal is to bring you the best minds in functional medicine, epigenetics, and longevity. I want actionable insights for the clinician and non-clinician alike. You can access episode transcripts, summaries, research citations, and more over at drfitzgerald.com, where you can also find information about our clinic and sign up for the e-newsletter as well. Thanks for supporting this podcast with your likes and your honest reviews, by sharing this with your colleagues, with your family and friends. Thank you also to our sponsors. These are companies that I trust, that we vet carefully, that we use in clinic practice, and that I use personally. Thanks to our Diamond Level sponsors. For over 35 years, patients and clinicians have trusted Integrative Therapeutics for their dedication to quality, potency, and accuracy, and for bringing us exclusive products backed by science. From sourcing premium raw materials to their meticulous manufacturing processes, they prioritize consistency, efficacy, and safety because our patients deserve nothing less. Find them at integrativepro.com. That's integrativepro.com. For over 40 years, the foundation of biotics research has been innovation and quality. Their goals remain unchanged: innovative ideas, carefully researched concepts, and product development with advanced analytical and manufacturing techniques. Biotics nutritional products are of superior quality and effectiveness. They are available exclusively to the healthcare provider. Find them at bioticsresearch.com. Precision Analytical, creator of the Dutch test, is launching a new educational program this January. They are offering evidence-based training on key topics like hormone metabolism, interpreting Dutch test results, and therapeutic strategies, including hormone replacement therapy, all aimed at improving patient outcomes. Become a registered provider to gain access to an expansive education hub with ongoing content, including webinars and case studies. Visit dutchtest.com/courses to get started and grow your practice. Thanks to our gold level sponsors. Timeline, fueling cellular energy for a lifetime of healthy aging. Find them at timeline.com. OneSkin, skin age reversal technology. Find them at oneskin.co. That's oneskin.co. Vibrant Wellness, transformative lab tests for wellness. Find them at vibrant-wellness.com. Hi, everybody. Welcome to New Frontiers in Functional Medicine, where we are interviewing the best minds in functional medicine. And of course, today is no exception. If you're with me here on YouTube, you can see I am sitting beside two amazing women up to some pretty extraordinary work in the world. I'm going to be talking to them about the Healing Depression Project, healingdepressionproject.com, if you want to check it out. Let me introduce you, and we will jump right into this awesome, really game-changing podcast. Dr. Achina Stein is the clinical director at the Healing Depression Project, at the topic of our conversation today. Again, she is a leading expert in functional medicine psychiatry and a best-selling author with over 30 years experience helping people to recover from depression. She's a board-certified psychiatrist, a distinguished American Psychiatric Association, and a certified practitioner at the Institute for Functional Medicine. She's also a former clinical assistant professor of psychiatry and human behavior at the Warren Alpert Medical School at Brown University. University in Rhode Island. She had an Amazon international bestseller, What If It's Not Depression? Your Guide to Finding Answers. And it offers groundbreaking functional medicine perspectives, instilling hope and providing healing pathways for those facing chronic depression. Sylvia Covelli, she is the founder of the Healing Depression Project. She's an honors grad from Boston College and a former social science researcher at Harvard University. She pursued graduate studies in finance and business law and dedicated her career to entrepreneurship, becoming an accomplished businesswoman. In parallel with her really extraordinary career, she also faced relentless chronic depression. She's been through over 60 different treatment types without finding sustained release. Her personal struggle, combined with her extensive background in human transformation work, led her to develop this extraordinary program, the Healing Depression Project. She's going to talk about her journey with us. Again, her own experience and her own journey prompted the development of the Healing Depression Project, the topic of our conversation today. So we're going to start with just some background on depression. Dr. Stein, give me some stats on the problem that is depression. Maybe the current incidence, but also, background. Are we increasing? Go ahead and talk about it.
Yeah. Thanks. Thanks, Hugh, for that introduction. It's great to be here. So stats. So major depression is probably one of the most common mental illnesses, and it's affecting more than 8% of Americans. That's like 21 million people each year. And 15% of youth, that's 3.7 million, ages from 12 to 17 are affected by major depression. And 10 times that, believe it or not, 280 million suffer globally. It is the most common form of types of depression. There's multiple types like bipolar and dysthymia, but suicide, it's increased to the extent that suicide is the second cause of death in teens. And it's pretty serious. And it's something that we absolutely have to do something different about than the usual way of treating depression.
And the incidence is rising, just really kind of like we see, chronic diseases in general.
Absolutely. It's rising, and it's significantly rose since the pandemic occurred, not just major depression, but also anxiety and other mental disorders. But major depression is definitely up there.
And what's interesting, so we saw morbidity and mortality numbers, generally speaking, kind of level out now that we're, some years post-pandemic, but depression, we haven't seen that same
level out. No, it's still increasing. Yeah, it's about the same or increasing depending on populations and where they're located, how much services that they can get. But there isn't a supply of physicians, unfortunately, to meet that demand. In fact, the number of psychiatrists and therapists are reducing over the years, and while these statistics of depression are increasing.
Why is that? How come the number of psychiatrists and therapists?
Well, I think partly it's overall many doctors, the number of doctors that are people that are becoming doctors is reducing. Yeah. I also, burnout is certainly affecting people in terms of continuing in the field of medicine. So I think it's multiple factors. And it's just the overload of the number of people that actually need it. And it's a combination of things, I'm sure.
Yeah, the system is just overwhelmed. Give me just a snapshot. We have a lot to cover today, but give me a snapshot of standard of care and, its utility in addressing this incident, this epidemic.
Sure. Yeah. I mean, when we'll talk about psychiatrists, many patients see family doctors who are overwhelmed and aren't really able to do a full evaluation. I think they do the Q9, and if they meet the criteria, they'll be offered an antidepressant. But I don't think that they are able to do a full evaluation or provide the time. And so if they're not comfortable doing that and prescribing, then they'll refer to a psychiatrist. And it does take quite some time getting in with a psychiatrist. But once they do see a psychiatrist, the psychiatrist will do, and I'm not, psychiatrists aren't the only mental health providers. There's wonderful nurse practitioners and people, depending on what state they're in, they have special training in mental health and prescribing psychiatric medications. But once they are seen, generally they are given a full psychiatric evaluation, which can take 60 to 90 minutes, depending on the provider's training. And that generally looks at the current symptoms, the past psychiatric history, past medical history, past surgical history, social history. They do a mental status exam and go down this decision tree to arrive at a diagnosis. And it's essentially matching a pill to an ill. And they'll be also offered, perhaps if it's appropriate, to do psychotherapy. Sometimes it's the psychotherapist that will refer to a medical provider for evaluation. There's cursory blood work done to rule out acute medical issues that might be contributing. And certainly there's a drug and alcohol history that is taken to determine whether or not a substance use is in play as well. And so usually, there's multiple diagnoses at play, not just psychiatric, but also medical. And it's generally a combination of things that can cause, especially chronic, persistent depression.
So there's so many questions from that. I'm just wondering where to go. I mean, you can see just with what you're saying around standard of care, how it would be tough to coordinate all of those pieces together. Just the suggestion. I mean, we know perimenopause, menopause, like moving through the transition and hormonal flow, like that would be a piece. Thyroid could be, like, there's so many pieces you're alluding to, and creating a cohesive plan around that seems to me that's got to be one of the reasons why we're seeing this the so-called chronic or treatment-resistant depression, because perhaps it just hasn't really been managed that well.
Right. I mean, what you're pointing out is absolutely right. What is it resistant to? Yeah. I mean, the definition of treatment-resistant depression is failing 2 trials or more of antidepressants, SSRIs or SNRIs. And that is the only treatment that is offered, essentially. And obviously there's other treatments now like ketamine and TMS, transcranial magnetic stimulation. But those aren't the types of modalities that are utilized right from the get-go. It's usually medication. And it's that's it. That's the definition. And so no other modalities are attempted in order to change the outlook for the patient. So when a person's told that they have treatment-resistant depression, that's a very hopeless type of diagnosis. Yeah. Yes. It really is. You might as well say that they have cancer. It's just, it's really terrible. So I that's a big pet peeve of mine. I hate that term. I really hate that term.
Yeah. And we're going to talk about it with you, Sylvia, in just a minute, your own experience with that label and how you overcame it and figured out an entirely different trajectory. Ballpark the percentage of people that are able to respond, that actually respond successfully to SSRIs and SNRIs. I mean, it's not impressive.
No, it's not. It's about a third of the population who are prescribed an antidepressant at the proper dose and for the proper period of time will respond. But what's considered a response is 48%. I'm not the best person with numbers in my head. Some people are really good about
That's
that.
okay.
But it's about 48%, and that's what is considered a positive response. I mean, that's really disconcerting. But then it goes downhill from there after a while. Sometimes people don't respond as well as they stay on the antidepressant. So typically the dose is increased, and then they might respond for a period of time, and then it's increased again. But then they start having side effects. So then they go down the dose, and another medication is usually added. It might be a different class of medication. Sometimes even the same class. I'm surprised to see that sometimes. Or a mood stabilizer might be added to it. So it becomes this polypharmacy of 2, 3. I actually have had patients come to me on 5 to 7 medications.
Extraordinary. And it's really difficult to change and taper. I mean, I think probably all of us in practice have seen, the fallout of maybe not quite that many meds, but just, I mean, certainly we look at the metabolic fallout, the really refractory weight gain, like all of this, the problems with pretty extraordinary side effects. Okay. Well, let's just move on. I mean, there was a massive aha early on in my career when I was in a clinical laboratory, and the idea that depression was actually, driven by inflammation, or certainly a subset of depression was driven by inflammation, was pretty extraordinary. I mean, I just remember being wowed, when we were looking at some of the cool, organic acid. It was this extraordinary moment, just really teasing out the idea that there's this underlying inflammatory phenomena happening, and that, it just revolutionized our thinking. But I was already in a functional place, but in functional medicine, and the laboratory was, providing really detailed laboratory analysis for primarily functional medicine providers.
Yeah, it is a big aha moment, especially even for functional medicine providers, because we still talk about serotonin and norepinephrine and dopamine, even still in this space. But I think we understand it differently, that it isn't the cause, it's the downstream effect. Yes, there are neurotransmitter imbalances, but that's not the cause of all of the issues. There are other issues that are happening in the body, as you mentioned, inflammatory issues, but there's also mitochondrial dysfunction and oxidative stress. And they all are interrelated, and one causing the other, almost this vicious cycle downwards. And part of the downstream effects is a change in neurotransmitter balance. So that's why some people may respond to medications, but if the root causes, and thank God, I just want to say, thank God we do have medications. I think it's really important for people to understand. I have a foot in both worlds, and I don't diss the other world, and it's life-saving for some people. What I envision for the future is to see medications used as an acute form of treatment, with the idea that at the root causes will be addressed, so that those medications can be tapered and discontinued. And I hope that that's where we'll be maybe 10 years from now, maybe 20 years from now. I don't know how long that will take, but almost like if someone was hit by a car and they had multiple broken bones, you're going to want them to go to the hospital, be helicoptered there, and have life-saving surgery and be put in casts. And when a person is put in a cast, they know that cast is going to come off, right? Whereas when people are put on medications, they're told that they're going to be put on medications and like, this is for the rest of your life. It's like, what? So now that more and more research is coming out about how ineffective medications are long-term, that people can start having side effects as a result of being on medications long-term, that I think at some point the pendulum is going to swing to where we reduce and discontinue these medications. And hopefully people will be able to come off these medications without the withdrawal syndromes that are finally being acknowledged from antidepressants, whereas before people were told that they're, imagining it and that it doesn't happen. I remember when people were told that the brain zaps that they were happening were delusions. I remember. That's how long I've been in practice. So it's just, you see how things evolve over time, of belief systems and then being proven in the same way that for the longest time, Zyprexa, which is a major antipsychotic medication that came out, and the company denied repeatedly that it doesn't cause weight gain, it doesn't cause metabolic syndrome, diabetes and high cholesterol. And finally, everybody knows that it does, and that whole class of medications. So over time, you start really seeing the truth about these medications, and hopefully we will adjust our way of caring for our patients, knowing these things.
You've said a lot. You've said so much. I know that people are listening and just feeling this rage. We have family members who've been on this journey. We have patients who've been on this journey, and it's wildly heartbreaking. The messaging, the gaslighting, really the gaslighting. It reminds me of the idea, in dentistry that mercury is entirely appropriate to use, even as OSHA was sitting over here requiring, protective approach, very stringent protective approaches for mercury exposure in other arenas. But in dentistry, it's somehow, dentists and assistants and patients could just be exposed to it. It's just absolutely extraordinary, the sort of the disillusion in that. And I'm heartened to hear you, just speak so plainly about it, speak about the body of evidence that's emerging around it to really demonstrate how inappropriate the languaging and the gaslighting has been in that arena, and the changes that are taking place. And I just champion, your voice and the important work in this arena. And I also want to say too, that it's easy for us to be very critical about meds. They're all bad. They're all horrible. Nobody should be using them. That's a very easy, low hanging fruit. When in fact, to your point, they're absolutely critical and life-saving. So I appreciate your measured, honest, embracing the nuance of the conversation. All right, so let's just swing over to talking about this amazing functional approach, and I want to know from you the key elements that you're considering in treatment-resistant depression, and maybe mention, because you are speaking to clinicians, some of the key labs you might be considering, and is there a consistent sort of foundational approach? So 3 questions: the functional approach overall, maybe some of the labs you're thinking about, and some of the interventions that are important for most individuals with depression.
Sure. So I start where the patient is, obviously. Mm-hmm. I gather a ton of information from birth onwards. I put all their information on a timeline, and I'm sure people are aware of that, but I actually do it. I don't know how many people actually do the timeline, but I actually do it. Mm-hmm. And I gather detailed information. So then we start with where the patient has the greatest motivation, starting with the lowest hanging fruit in terms of where they want to start. And we do start with lifestyle. Lifestyle is very important: getting sleep in order, moving your body, breathing, meditating. These are all basic things. But I think where some people, because I know this is a lot of practitioners listen to this, I think the best place to start, at least where I start, and I feel like it gives a lot of bang for its buck, is to really start with digestion. Mm-hmm. And to make sure that digestion is happening starting in the mouth, and that we're releasing bile and acid appropriately, which, one triggers the other. You're going to know just from the history whether or not somebody has problems with digestion, particularly low acid, especially if they're low in B12 and iron, right away,
Sure.
you know
Yeah.
that. And if they're low in vitamin D and vitamin A, then you're going to know that they're probably not releasing bile. Certainly, we want to look at their stool and make sure that, see if they have obviously food in their stool, or it's floating, or it's light colored or white. You can get a lot of information just from looking at the stool, but making sure that they're completely evacuating, that they are digesting their food, and putting practices in place right from the get-go, like breathing before every meal and looking at your food, chewing your food, tasting your food. And that could be a really easy way to start a little mini meditation and habit stacking those right away. So I don't feel like people spend enough time with that. And that can tell you a lot about the person who's even just starting that very small thing, about their ability to tolerate change, their ability to follow instructions, right? Just from those little things. And so getting digestion going is going to be really important, because once you start getting a flow of the organs, like the liver moving on a cellular level, and get these organs working in tandem. So rhythms of the body, really respecting the rhythms of the body. I always say, that, with digestion, shop opens and shop closes at breakfast, shop opens and shop closes, shop opens and shop. And there's this rhythm that you have to respect. And most of our society runs around with a big Stanley cup in their hand that has a smoothie. That's all they drink in the car. They're constantly grazing, and you're not even giving your gut a break, and they don't necessarily, most people, follow the standard American diet, eating tons of carbs and sugar and not enough protein, not enough fats. So diet would be certainly the next step. And to see how the body receives the food is going to give you a lot of information. And so obviously we do, a full diet recall of 3 days at least, and try to get people on a low carb, low sugar, and in my practice, dairy-free and gluten-free, just because I see so many sick patients that are extremely inflamed and have autoimmunity, and anybody who has an autoimmune disease should be gluten-free. And that's a whole nother conversation, but people don't even know that little piece of information. But really doing whatever you can to what we call unmuddying the puddle, by removing these highly inflammatory foods from the get-go, and then adding as many vegetables as possible. And just by doing that, a lot can change for people. For the program, you'll learn, or I don't know if we'll talk about it more, but for the program, our goal is to have a low carb, sugar-free diet and increase fats and proteins, which over time, depending on what people need, we're going towards the direction of a ketogenic diet. And not everybody needs the ketogenic diet, but there's certainly some studies that show that the ketogenic diet is great for the brain. There's more studies for epilepsy over decades, but not necessarily depression, but those studies are now coming out for depression.
Some really interesting work looking at the ketogenic diet in bipolar disorder, I believe. Mm-hmm. Isn't it out of Stanford, if I'm not mistaken? Or one of the University of California branches. Some just really, really cool work is happening with that. It does make a lot of sense. I mean, that's going to just drop inflammation like a stone, and those ketones can be really nourishing.
Absolutely. And it's more likely to work for people who have metabolic syndrome. So one way that I determine what supplements to use downstream, and I tend to, I'll give supplements downstream for patients who are still experiencing a lot of distress from depression and anxiety, in order to make them comfortable, so that they are comfortably depressed, for lack of a better word. They're not in danger anymore. They're not desperate. They're still depressed, but they're not in this desperate place. So I'll use supplements and medications to help a person be comfortable. Then I'll go upstream to figure out what are the root causes that are causing all of these issues. And so, ketogenic diet is excellent for somebody who has metabolic syndrome. So if they have metabolic syndrome, then and depression, then the ketogenic diet is going to work wonderfully for them. And so, and I also know that sometimes people who start the ketogenic diet, they find that their cholesterol goes up, and many of their conventional providers get really panicked about it. But I feel like that is going to be just in flux while you're starting something new and you're flushing out your liver of all of these fats. That where are they going to go? They're going to be in the bloodstream for a period of time until they're eliminated from the body, right? So eventually those cholesterol levels and triglyceride levels, they'll go up during that period of time, but then they should come down. And you might need to use medications, cholesterol binding medications like statins or binders, to be able to sort of soak those up in the meantime. But yeah, there's different ways of determining which supplements are helpful. For example, if somebody has mitochondrial disorder, there's some studies that show that carnitine is helpful. And or if they have blood sugar dysregulation and they have shooting up of blood sugars and then crashing down and to the point where they're hangry. So chromium would be a great thing to add. Mostly everybody would benefit from a very low dose of lithium. Very low doses, like of 10 milligrams, can make a difference without any side effects. It's only above, I think it's 100, and the study showed that it was 112 milligrams. Above that, you might start having side effects, but really low doses are not a problem. So I think I'm trying to think if there's anything else that I would want to say to answer your three questions all at once. So the other pieces that are really important, that at least from my perspective as a psychiatrist, that is important to remember is stress. And I think people know, stress absolutely can cause problems, especially with being in fight flight. You are not in rest, digest, and heal mode. So it's going to be important for you to do all these stress reducing activities like meditation and breathing. But some people have a really hard time getting into that place. They're too antsy. Their mind is monkey mind. It's very, very hard to do. So I try to find, depending on the person and what else they do in their life, I try to find moving types of meditations. That those are easier to do. But some people who've had a history of concussion that then resulted in IBS, which then resulted in anxiety and depression, you'll want to have them do vagal nerve stimulation. If they've had quite a bit of trauma where they're still reacting again and again and again, you'll want to include also limbic activation, brain retraining of limbic activation. So it depends on the person, but it's really important to look at the level of trauma that people may not necessarily talk about to the depth of how it affects them on a day-to-day basis, and they may not even know. So it's really looking for that. And so being a psychiatrist, I'm more in tune with those kinds of things, and I pick up on those types of things. So
would your book be appropriate? Your book is called for, again, I'll just mention it. What if it's not depression? Your Guide to Finding Answers. We can link to it in the show notes. Would it be appropriate? There would be some guidance in there for clinicians as well as for individuals?
Absolutely.
Good. Because you're touching on a very depth functional approach, and we don't have time to go through all of the pieces, but I can see that you're just casting that wide net. It reminds me of the breadth and depth of our toolkit. It's very rich.
Yeah.
Not everyone is going to respond, or it's to B12, but B12 is going to be 100% game changing as a piece of the puzzle for some, and just as you're suggesting, you can, as somebody on the metabolic continuum could respond spectacularly to a ketogenic diet, but another person who is not anywhere near is not going to yield that benefit. For really, so stratifying those interventions is essential. I just wanted to say, by the way, is just thinking about the change in cholesterol patterns with certain individuals on a keto. I have started, and this won't be appropriate for everybody, but I do want to give a shout out to the Clearly scan, the CT coronary scan being, kind of supplanting the calcium score, where we can get a better look at what's happening with plaque activity. And you'll see that folks who are low carb, can have very, just really minimal plaque activity. And that can kind of help stratify who needs to go on an aggressive cholesterol, reduction protocol.
Absolutely. And getting other labs like the oxidative LDL and getting the fractionated cholesterol panel is really helpful as well to determine whether or not it's safe in other ways for people. So especially when you're treating depression and people find incredible benefit from the ketogenic diet, you're going to want to make sure that the other organs in the body are benefiting as well. But it's this is all new stuff, and we're going to learn more and more as time goes by with more and more research.
You've likely heard about the longevity benefits of peptides. They're in skincare, supplements, they're everywhere. But not all peptides are created equal. Developed by skin longevity scientists, OS1, which is found in OneSkin topical supplements, penetrates deeper layers of the skin, impacting cellular level biomarkers for visible improvements in lines, wrinkles, and thinning skin. Ready to experience OS1's benefits? Use code Dr. Kara for 15% off your first order at oneskin.co/DRKARA. Dr. Fitzgerald deeply researched how to age well, and a clinically studied formula that can do wonders for your aging process is Qualia Senolytic. Senescent cells, or zombie cells, accumulate in your body past age 30, wasting your energy and nutrition and contributing to accelerated aging. Qualia Senolytic combines 9 vegan, plant-derived compounds to help naturally eliminate senescent cells to help you feel years younger. Try Qualia Senolytic at qualialife.com/Kara15 with code Kara15 for 15% off. That's Qualia Senolytic at www.qualialife.com/Kara15.
I do want to mention, though, like you mentioned, B12. Yeah, B12 is great, and so is folate. And I like to see people take a B complex, because it's like, to me, it's like the B vitamins are like a group of vitamins that are holding hands, and it's always going to be dependent on the one that's the lowest.
Yeah.
And they work as a group. And so if you take only one of those, like just B12 or just folate, you end up, using all the other vitamins that are needed for them to work as a group. It's what we call a rate limiting step.
Yeah, and also inflammatory. The kynurenine pathway is, which is going to usurp all the serotonin, is very B dependent. A lot of different Bs are playing a role there. Mm-hmm. Okay, I want to move things over to talking to Sylvia. Thank you, Dr. Stein, for that, really nice background in functional medicine, psychiatry, and what you're thinking about more broadly with individuals. Was there anything else you wanted to add before we start to talk about the Healing Depression Project and Sylvia's journey?
Yeah, no, it's just that, it is a journey. Mm-hmm. It's a journey, and that people ought to see it as a journey, that it takes time to peel back those layers and keep working on it and understand that it's an evolution in resolving depression and other chronic illnesses.
But we do have a tool. We have a very real, vibrant, effective toolkit, even as there can be a journey in the process of identifying the interventions that are going to really work, which, Sylvia, happens to be your own experience.
Right.
Struggling and moving through many different treatments. So you were, by day, this, superhero woman tackling the universe, and then struggling with really incredible depression. I mean, just give me a little bit of talk to me about your story.
So it was a very long journey. 25 years with depression, recurrent. It will get a little better, but then the symptoms eventually will come back. And I thought it was just, a very unique case. But now, as I'm hearing so many people, I'm talking to so many people, it happens that my story is extremely frequent. Just people not responding to different treatments regarding depression. And that's how we have become to this term of like chronic, or like, the so-called treatment resistant depression. So I did traditional treatments. I started with, conventional psychiatry, and I did pharmacological approaches. In my case, antidepressants didn't work. Actually, it made things worse. I developed new symptoms that I did not have before the medication. And I'm not alone there. So
Such
Dr.
as,
Stein
what were the symptoms that you developed?
New symptoms, I mean, extreme fatigue, but it was like lethargy. Like I couldn't like move the body. It was not just before. I was like energy drain, and that became really intense. Muscle aches. My whole body was like aching. And sometimes I became more sensitive to light, to sounds. I would feel like really, claustrophobic in crowded places. So, but those things I did not have before. So it was just related to the medication. So those are just a few, but there are like many more. But so antidepressants didn't work, and I tried several other medications that psychiatrists, they just, I guess everything that we were talking about before is they don't have enough tools. That's what they learn in school. Conventional psychiatrists, that's they're just taught that these are the pills, and they're supposed to cure A, B, C, D, but they don't. Like Dr. Stein was saying that 1/3 of people respond to antidepressants, and she explained very well what respond means, because it's very different from getting better or actually curing the condition. Because if you look at like how many people like has achieves complete recovery with antidepressants, then the number is less than 10%. There are like amazing studies showing that. So I was among those people. And I kept trying like different other approaches, more conventional, regarding also talk therapy. And then from there, I didn't stop there because, that didn't work. So I try, different retreats. I try other, calming the nervous system through meditation. I tried yoga. I tried all sort of programs. And I was, really fascinated by going away to a retreat or to, any type of program that involved just getting out of my normal setting and just going away. And some of them work, but again, everything was temporary. Depression always found a way. The symptoms will come back. And the thing is that you never know when. So just one day you will wake up and all those things that you were doing better, then you're not doing better anymore. And it was very discouraging, the whole journey, because doctors kept telling me in different ways that that there's no cure. Just the fact that they give you medication forever just because it's not being managed, as Dr. Stein wishes it is, that is, as an acute. If the person is in an acute state, then the medication should be for X amount of months, and it should be part of a treatment or a strategy behind. But here, there's nothing. Like just psychiatric, they just give you the pill, and then you stay there for 10, 20 years and for the rest of your life. And if you want, like in my case, I wanted to get off of the medications, and like the doctor insisted that I shouldn't, that I was gonna feel worse. Then I just thought to myself, like, okay, really? I'm already feeling really bad. How much worse this is gonna get? So I had to do it like on my own. I didn't get help for that. And just these recurring ideas on how you're going to have to deal with that, forever. There was not really, I guess, hope is not something that you hear from a psychiatrist, and they're right in a way, because since their treatment is based on just medications, then it makes sense that the patients are not getting better, because it requires so much more than that. So I just continue. I trying different things, and after 25 years of dealing with it, and after being told by doctors that my best bet was to accept the condition, make peace with it, that was part of who I was, actually sentences like learn to live with it. And yeah, a doctor that says that, he doesn't understand the depth of the struggle that depression can be, because it's not something that you can learn how to live with it. So I didn't stop, continue doing different things. And then at some point, about 25 years into this battle, I just kind of stopped my entire life. I stopped working. I stopped, the things that I was doing. And I concentrated myself 100% of my time and my energies on just healing. So I went back to the programs and the retreats and the medical approaches and all the different things I've done. And I reviewed them. It was over 60 different ones over, the time of 25 years. And I extracted the pieces that worked the best, and I started really making the connection between mind and body, and just seeing how disconnected all the doctors that I talked to were, because it was this assumption that everything was in my mind or just in my emotions, but it was never this, it was also an aha moment for me when I said wait, so this thing is actually rooted, in my body. There's things that are happening inside that are or causing or at least contributing to these symptoms. So at that point, I just put a program together, and I also had a more functional medicine approach. And I also did significant changes in my diet, in the sleep cycle, and I implemented a lot of the things that I knew were good and that I had gotten some benefit out of it. But the thing is that I implemented them every day. And I think that's when I saw a big change in my life. Because if you know that, and I hear all the time, I felt better when I was sitting this way. And then the question is why did you stop? Or why didn't you continue that? Or, I know exercise is good, but then we still don't do it every day. And it's same with meditation and, again, nutrition. Why? Again, because it's really difficult to change the way you eat, and it requires for you to get informed. It requires energy. It requires, a lot of time, and depending on who you live with, if you're going to start like a specific type of diet, and then everybody else at your house is eating something different, then it's an added challenge. So anyways, I managed, because I stopped everything and this is the only thing I was doing, I managed to change all the things that I had not been able to change while I had like my super busy life. And I just, within a month of being doing those things, I started to feel a difference. And I can say like 3 months into it, I felt like a complete different person even from a biochemical perspective.
Incredible.
I was just someone that had energy again. I was waking up with mind clarity, with peace, and ready to start the day, which never, it was always something that was a struggle for me, those, that waking up in the mornings. So I got better, and I haven't had those symptoms back. It's been almost 5 years.
And let me just ask you, I actually have a thought and then I have a question. We were talking about IFM and the immune module, and one of our first teachers was Dr. Alex Vasquez, and he used to teach something. We were talking about Alex. If you have 10 interventions and each, maybe move the needle 10%, that's 100%. I mean, it's not that cut and dried, in most cases, but generally there's truth in that, if you can find the handful of interventions that are exactly right for you and to your point. And so I think, a lot of people do X intervention for a little while and notice some benefit, but they fall off because not quite the full package of interventions they need as you put together. So, certainly, people with depression have, in my practice, come to me having tried dietary pattern changes, and they're able to sustain it for a little while, but they really don't have the energy to do it long term. And maybe it's a piece of the puzzle, but it's not the entire puzzle. So bravo you for tracking this so extraordinarily carefully over your journey, like where you found the energy to actually note somewhere, hey, this helped a little bit, this didn't, et cetera. And then, to be able to take the time off to do them all. So my question is, you've got some non-negotiables in your life. I'm imagining that there's a structure to your life these days that's that really has to be in place. Getting enough sleep, getting some exercise, getting some sun, like those things. Your diet probably is something you put a lot of attention into. I mean, would you say that's true?
Yes, all of the ones that you mentioned, plus meditation. So up until today, I have those non-negotiables, and I think that's where you really are able to find the sustained well-being. And that was the main inspiration for the program, because the program it's 45 days, but 30 days are in a retreat setting. And it's just because I know firsthand how hard it was for me to implement these things. But
let me just once again say, this is the Healing Depression Project, healingdepressionproject.com. So you took what you learned, and then you decided, I'm going to create an in-resonance program. So, I'm going to create a place where people can come and do this.
Yes, exactly.
Huge.
Because And then it's just everything came together. I saw my own struggle in putting these things together. And then I also started hearing over and over from different functional medicine doctors that one of their main frustrations was that they will tell the patient everything they had to do. They will write it down. Actually, some of them spend a lot of time and energy into explaining things. And then the patient will come back 3 months after and they haven't done it. So, or they have done just a little bit, or they try it and they stop. the doctor is like, well, this is actually the medication, and if they're not doing it, so it was also like as a response to how hard for someone with depression is to implement a treatment, a functional medicine treatment. And any change in your life, because if you think about it, the things that you need to make a change, I mean, the first thing is physical energy, because if you don't have any energy, I mean, you're not, you're not even going to cook. You're going to just grab your phone and, order online at best. So, and you need hope. And hope has been taken away from people like us, because doctors themselves, as I was explaining, they don't give it, and they actually take it away, like, conventional psychiatrists. And then also the fact that you have tried one thing, two things, three, then, that takes the hope by itself, because you see, like, and then you come to this conclusion.
It didn't work.
Yeah, exactly. You come to the conclusion, I tried all, I did it all, and nothing works. That's it. And then it's really hard to move the person from that point. The way I did is just I kind of like challenge myself, and I said, like, well, okay, so how come you've been able to do all these other things, and what about this? So, but this is like a specific type of personality that was able to achieve that. So what the program is intended to do is to actually, in a gradual way and through the science of habits formation, to help the person to change all those things that they need to change, and all the things that the doctor like recommends. So it's to change the nutrition, and with a lot of awareness, explaining why, because the more awareness you have and the more you understand, oh, this is why I'm doing this, and this is what happens. For example, like if you really understand why sugar is bad and what happens to your brain when you're eating sugar, then you will think it twice. But if you just think that, we've been sold on the idea that sugar makes you happy, so it's really hard to break away from that. So we help the person with the diet. We help the person with a morning routine that includes meditation, that includes exercise. That exercise is a walk outside, because it's it's in order to get sunlight. And then, in a special way, in order for you to get all the sunlight, you should not be wearing like sunglasses or a hat, just sunscreen, of course, but not in a way that you don't like stop the light from coming into your eyes and then, get into the brain. That's what it needs to get to.
Let me ask you, I have a couple of questions around that. Just going back to a point Dr. Stein made, you're meeting this individual where they're at. I mean, do you want everybody in the program meditating, or might you tweak that for somebody who wants to do something more physical? Or that's question number one. Is there an individualization layer going on? Question number two is, something that we haven't talked about. Depression is an incredibly isolating and lonely journey, is certainly why we see, to your point, people having very hard time implementing a functional medicine approach that's multi-layered and requires some energy and focus. There's the community element here we just haven't really spoken to. So speak to that as well.
Yeah. So the program is very gradual. So we'll meet the person at where they are at. So it's not that they will be expected to, meditate for 30 minutes the first day and take a 45 minutes walk. That's not how it works. It's just in a very slow and gradual manner. We'll take the people to do the things, and it depends. Someone that is already doing it, then they will go faster. So I guess the speed of the program can be different, but we're gonna take everyone to do, for example, like the walk and the meditation. The meditation is because we're not only addressing the stress and the nervous system there, but the meditations that we're gonna be doing are grounded in a neuroscience. So it's to lower the waves in the brain, and therefore that the person is able to access the subconscious mind and therefore to replace, thoughts and emotions, and it's a rewiring of the brain in that sense, because there's a lot of limiting beliefs that are in there that they
Sure.
need to be addressed and actually replaced. So if you really want to heal, and even just the thought that you can heal from depression is the first thing that we work on, because people think that, just as I did, that I cannot heal from this. And they don't even, the word cure is something that is like, that happens to other people. This is not something that is going to happen to me. Just opening the brains to the possibility that they could achieve, a point in their life where they don't have these symptoms is, it's very important. So there will be.
What's the structure of the program? Give me the daily flow.
Okay. Let me answer first the previous question about the community. So that's one of, I couldn't agree more. With depression, we've been trying to heal in isolation, and that's extremely difficult because you need the support network. You need other people as well. So this program is unique because it's cohort based. So it means that everyone, it's only 15 people, so it's very small, it's personalized, but they still get all this synergy and support of the group, of the community. So everybody starts on the same day, everybody finished the program on the same day. There's a graduation day even. And so it's that develops that sense of community, and you're going to relate. You're going to see like, oh, here I was thinking that I had the worst case of depression, and that my case was, that nobody could like cure it. And then you're going to see other people, and you're going to see it's healing together and gradually getting better together. And that's extremely powerful. And that also builds, new social connections for them for the future after they leave the program.
You have the in-person month-long program, and then you take it online after that. So they're going to continue as a community.
Yeah. They continue as a community, and it's 15 days. And those 15 days is every day we're with them in the afternoons to help them with the implementation at home, to integrate everything that they learned during the retreat, to integrate it into their day-to-day lives. Because if they don't do it in their day-to-day lives, if they don't do it long-term, then the benefits will eventually go away. Their body, their mind, the emotions will go back to where they were. It will be like amazing 30 days, and that's going to be it. So the real challenge with these residential programs is what happens when you go back home. And that's the scariest day of all, is getting back home and you're like, oh my God, I'm alone and I'm supposed to do.
Are you working with them to put together their in-person, their live support circle, and how they're going to be able to kind of manifest the continuation of some of these?
Absolutely. Yeah.
The last 5 days of the program is called Life Integration Mastery, and is just how, in an individual basis, how they're going to integrate these to their life, depending on what are the obligations, who do they live with, where do they live, and then and what are they committing to, how are they going to replicate this at home. The program is taught as a training, and I like to say that the way that we're seeing every model is that if the person cannot replicate it at home, we're not teaching it, because we don't think that that's going, unless it's treatment or a therapy, that's different, right? But if it's something regarding like lifestyle habits, if they cannot do it by themselves at home, and we're going to provide everything, like all the tools, the knowledge, and the empowerment to make them feel that, yes, you can do this. And they're going to feel so much better during those 30 days that's going to be the reset that is going to make them believe that this works. And it's not true that they had tried it all. It's not true that nothing works. So once that change happens in their mind, then they're gonna say like, oh, okay, and they're gonna be, not only willing, but like they're gonna comply with doing this when they go back home.
Do you have outcome data? I mean, have you done pilot?
The program is launching in March. So the first program is going to be in March
2025. March 2025.
Yeah, from 2025. And that's all the professionals that we're working on. They just like Dr. Stein here with us, are people with 30 years of experience that they're going to be doing, what they do in their private practices, but in a residential, like retreat style setting.
And where is it? Where is it?
Austin, Texas.
Oh, it's
Austin.
in Austin.
So
okay.
yeah. So
you're going to be going out there, Dr. Stein, for the program. You'll be there.
Yes, I will be.
That's amazing.
Yeah. She'll be there the entire 30 days. Our nutritionist, we're doing metabolic psychiatry, and the diet that we're implementing is a ketogenic diet, especially designed for brain health. Mm-hmm. And our nutritionist, we're really lucky to be working with Beth Supekania. She's a very, very, very well-known person in ketogenic therapy as well, with over 30 years of experience. She's going to be in person just with the implementation. The participants are going to be wearing a glucose monitor, and ketones are going to be measured daily. Okay. So we're not going to be guessing if the diet is working. We're going to know if it's working and what's happening, inside of them.
Right. We're also going to be doing research. So Kat Toops is our research director, and she'll be, you know her. Yeah.
Sure.
She's amazing when it comes to research, and we'll be gathering data. We definitely are going to publish this.
Oh, amazing. So this is all under IRB, and you'll be able to publish on this data. Wow. That's absolutely terrific. So there's the diet, there's the meditation component, there's movement, there's, classes on learning and understanding the phenomena of depression, and
there's another piece that is the trauma piece. And this is another reason why people don't get better from depression, because it really requires a whole person approach. It is in the body, it is in the mind, in the emotions, and even in the spirit, like how connected they feel to life. So what I saw in what I implemented for myself is I started getting results when the things that I was putting into work were addressing all the different dimensions of my being. So the program does that too. And in a simultaneous way, so that all the parts of you start to heal simultaneously, and they help each other instead of like derailing the process, because like if you're doing better in your mindset, let's say more positive mind, but the body is really at a bad place, like lacking energy and feeling bad, then the body will derail that energy that you could have done, in your mindset, and so on with the other areas. So the other area is definitely trauma, the emotions. We're doing 50 hours of group psychodrama therapy, which is being proven extremely effective for people with depression, especially to achieve, to be able to work through unresolved trauma in a shorter amount of time. And we're doing that together with somatic work.
So let me just ask Dr. Stein quickly, comorbidities. I mean, are you leaning mostly on depression, or can individuals who, have a diagnosis of PTSD, post-traumatic stress disorder, or, anxiety, panic disorder, et cetera?
Well, they have to have a primary diagnosis of major depression, chronic, treatment resistant, essentially. And yes, they can have other diagnoses, bipolar disorder, and PTSD, anxiety, comorbid diagnoses, but they need to be stable and not suicidal, not desperate, basically in a safe place before they come, and have been in a safe place for a period of time where their focus is on getting well and not in this acute depressed place. Yes.
Okay. So they're going to be, and that they have some commitment and ability to engage, actively in their treatment. So Sylvia, talk about the cost, talk about the scholarship, maybe mention whether you're working on insurance. So just talk about that piece, actually making it happen.
Okay. So, well, residential care is very expensive here in the US. We managed to get really generous scholarships. And so people that are applying are getting scholarships for, up to 80% of the investment. So this is a great opportunity, for doctors that are listening to, and if they have patients that despite, the best care, they're still struggling with depression, maybe because they need like a whole person approach or because they need a more immersive approach, then this might be the opportunity for those patients to be able to access residential care. And yeah.
I'm imagining at some point you might look and see whether, out of network benefits, or likely that's something down the line, but yeah.
In the future, yes, we will.
Good. Mm-hmm. That's fabulous. Yeah. What else do I want to say? So people can go to healingdepression.com. Physicians can go there to find out how to refer.
Yes. It's Healing Depression Project.
Excuse me.
Yes.
Yeah.
And to refer, the best way is to just ask the patients to book a call with us. The call will be taken by me or by Dr. Stein, and we'll just discuss like the journey of the person and see if the program is a good fit for them, and talk in detail about the program. It's just healingdepressionproject.com/call is how they can book a call with us and find out.
You have your first cohort starting in March, and then when is the second cohort slated to start?
At the end of August.
Yeah. Oh, okay. So soon.
In 2025, we're going to have a program that begins in mid-March, and the other will be, at the very end of August. So it will be during the month of September.
Okay, perfect.
Yeah. So it's only 2 during the year.
Okay. Well, ladies, thank you very much for joining me on New Frontiers in Functional Medicine. This was just a great conversation. I wish you the best. I just extend, all my support to you. We'll certainly lean on our platform to get the word out for you. It's just, an amazing opportunity and just potentially game changing. I'm so glad that Dr. Tubes is involved in gathering data and that, you'll be able to publish. Thank you both so much for joining me today.
No, thank you for having us, Kara.
Kara, thank you so much.
As always, thank you for listening to New Frontiers in Functional Medicine, where our sponsors help bring you the very best minds in functional medicine. These are brands that I know, I trust, I use in clinical practice, and I can confidently recommend to you. Disclaimer. This podcast is for informational purposes only. If you have a specific medical concern or if you have any questions, please speak with your healthcare provider.